Welcome to the UNCG MSAT Continuing Education Module on Evidence-Based Practice. This part, the basics, we will be going over some of the basic concepts that we teach our students here at the UNCG MSAT program. Please complete all 10 parts and the quiz that follows to receive your CEU. Let's begin. The first thing we teach our students in evidence-based practice is to look at the values that they get when they're reading the literature and the evidence. We want them to critically evaluate and appreciate all the evidence, but we give them some ballpark values to remember. We tell them that anything greater than 0.75 should be considered a good statistical test or clinical trial, and anything less than 0.5 should be considered poor. The basic vocabulary we start our evidence-based practice with is validity and reliability. Validity, the degree to which the instrument measures what it is supposed to measure, and reliability, the consistency between measurements. As you can see in the top picture, it's illustrating validity, whereas what you're supposed to be doing is hitting the bullseye or as close to it. You notice that the 5 shots are pretty valid because they're doing what they're supposed to be doing. The bottom picture is illustrating reliability, very consistent and very well grouped together. You'll also notice that the bottom picture is demonstrating poor validity. Although they are very reliable, you're not doing what you're supposed to be doing by hitting the bullseye in the middle. We also talk about intra and inter-reliability as it relates to patient care. We talk about intra-reliability being you, the same examiner, doing multiple measurements over time on a patient, perhaps a rehabilitation post-operative, trying to demonstrate an improvement objectively in range of motion using a goniometer, whereas multiple examiners and multiple clinicians looking at the same patients over time. Taking validity and reliability as our basic vocabulary, we look at the next section of evidence-based practice, which is the contingency table. It is a simple 2x2 table for which most of our statistical analysis that you will read in the literature and that our students read is based off of. A contingency table has a diagonal of true positives and true negatives. Using an example of the Lachman's test, a true positive is a positive Lachman's with a patient who actually has a torn ACL. A true negative is a negative Lachman's in a patient with an intact ACL. This diagonal gives us high accuracy. The opposite diagonal gives us low accuracy of false positives and false negatives. Please keep this contingency table in mind as you proceed for the subsequent sections, as this is going to be used to calculate most of our statistical analysis.